Hello everyone, my topic for paper presentation is evaluation of dexmedetomidine and nalbuphine as an adjuvant to ropivacaine in lower limb surgeries under epidural anesthesia. Epidural anesthesia is commonly used for providing the intraoperative and postoperative analgesia in lower limb surgeries. Very few studies have compared the intrathecal nalbuphine and the dexmedetomidine in lower limb orthopedic surgery under epidural anesthesia. Hence, this study is designed to compare the efficacy and the clinical profile of the nalbuphine and dexmedetomidine with ropivacaine. Come to the drug, that is Ropivacaine. It is a levorotatory propyl homologue of bupivacaine and it is less toxic to nervous system and the heart. It has a lesser propensity to motor block as compared to bupivacaine. Dexmedetomidine, which we are using as an adjuvant, is an alpha-2 agonist and nalbuphine is opioid. Dexmedetomidine decreases the sympathetic outflow and norepinephrine release. It has the sedative, anti-anxiety and analgesic property. While nalbuphine is a kappa agonist and a mu antagonist, it causes the activation of supraspinal and the kappa receptor and produces the analgesia. Our aim is to compare the clinical profile of dexmedetomidine and nalbuphine as an adjuvant to ropivacaine when administered epidurally for lower limb surgeries. Primary objective is to compare the onset of sensory and the motor blockade, then the peak sensory and the degree of motor blockade, compare the duration of sensory and the motor blockade, the level of sedation, duration of analgesia provided, and the secondary objectives was hemodynamic alteration, quality of postoperative analgesia and other associated side effects. Methods used: a prospective observational study. Location is IJGMC Nagpur, and patient were posted for the elective lower limb surgery after the IEC approval. Inclusion criteria: patient undergoing the lower limb procedure under epidural anesthesia, ASA grade 1-2, age between 18 to 50, 150 to 170 height and 40 to 80 kg weight. Exclusion criteria were patient who do not giving the consent, ASA grade 3 and the 4, patient with coagulation disorder, local infection, spine deformity, spine surgeries, hypersensitivity to local anesthetic agent, cardiovascular diseases, COPD and renal disorder. Sample size estimation was decided to be the sample size of 70 and 35 in each group, which was conducted by the Singh Bajwa et al. Using the following formula. The patients were divided into the two groups, 35 for each. Group RD, which is ropivacaine with dexmedetomidine, 15 ml of 0.75% of the ropivacaine with dexmedetomidine, 1 microgram per kg epidurally, diluted with this normal saline to make the total volume of 17 ml. Same as in nalbuphine, that is 15 ml of 0.75% of ropivacaine with the nalbuphine 250 microgram per kg epidurally, which is diluted with the NS to make the total volume of 17 ml. Then informed written consent taken, patient co-loaded with the 10 ml per kg of the Ringer lactate solution, all aseptic precaution taken and epidural catheterization done. After 5 minutes of the administration of the test dose, patient received the study drug according to the study group allotted to them. Parameters studied were: for the sensory characteristic, the onset of sensory block 2 T10, maximum level of sensory block and time to achieve it, time for 2 segment sensory regression and regression to T10 level, duration of analgesia. Motor block characteristic: onset, time to achieve the maximum motor block and the duration of the motor block. The statistical analysis was done using the EP Info software version 7.2. Numerical variables were mean and the standard deviation. Test applied were the student unpaired t-test and the paired t-test. Results: the demographic data, age, weight, height and the ASA grade were not comparable. Gender distribution was also not significant. Duration of surgery was also not significant, as both lower limb surgeries were included in this study group. Type of surgery: ankle surgery, femur surgery, knee and tibia surgery, and hence the p-value was 0.8, so that was also not significant and was not comparable. Sensory block characteristic: for the onset of sensory block, maximum sensory level, time to reach the maximum sensory level, time for the 2 segment regression, time for the regression to T10 was maximum and the early with the dexmedetomidine group. and that of Nalbuphine group. So all these characteristics were comparable in both the group. Motor blockade, the onset, time to achieve the maximum motor block, and the duration of complete reversal of the motor block was also comparable in both the group. VAS score of at 2 hour was comparable, and at 24 hour it also comparable in both the group. Sedation score was also comparable in both the group from pre-op to up to 24 hours of the duration of surgery. Complications, in Nalbuphine group, the nausea and vomiting is seen. So nausea in 2 patients and vomiting is seen only in 1 patient. Come to the discussion, motor blockade. The onset of motor blockade and the time to achieve the maximum motor blockade was earlier in dexmedetomidine group when compared with the nalbuphine group, and time to complete the reversal of motor blockade was prolonged in dexmedetomidine group than the nalbuphine group. Come to the sensory, the onset of sensory block was faster with the dexmedetomidine as like the motor than the nalbuphine, and the time for the 2-segment regression to T10 sensory level and the duration of analgesia was prolonged in dexmedetomidine group compared to the nalbuphine group. The finding in our study regarding the dexmedetomidine was comparable with the studies conducted by the ATR in 2014, BASWA in 2011 and Taltrecher in 2017. The finding in our study was regarding the nalbuphine was also comparable with the studies conducted by the Michael in 2017 and Tiwari in 2013. The limitation of our study was the only lower limb orthopedic studies were included. Onset of pain at surgical site may not be given an accurate duration of analgesia. No control group, only SA12 group, age more than 50 were not included, and sample size was small. Conclusion, we concluded that the dexmedetomidine is better adjuvant to the Ropivacaine for epidural anesthesia when compared to the nalbuphine, as it provides earlier onset of the sensory blockade, prolonged duration of sensory block, post-operative analgesia with stable vitals, and minimal side effects. Thank you.